Dry eye disease management. This third seminar of the Alcon Experience Academy series on dry eye disease will look at the stage managed approach to dry eye disease as recommended in the TIFOS JEWS 2 report. I think we all appreciate the need for compliance and for the patient to understand the chronic nature of the disease. With that in mind, a large percentage of the time allocated to the first dry eye assessment should be spent explaining the disease, the need for compliance and adherence to the instruction given, and also checking the patient's understanding of the information given. We should also take time to explain that using eye drops for a few days will not cure the disease, but only provide some temporary relief, and symptoms will return when the treatment stops. Our objective as eye care practitioners when managing a patient's dry eye disease is to restore the homeostasis of the ocular surface, or at least return it as close to this as possible. Most of the dry eye disease that we will see in practice can be managed in practice and by following a staged managed algorithm. Let's look at the first steps in the treatment plan. I mentioned at the introduction the importance of education the patient on the disease. Therefore, education regarding the condition, its management, treatment and prognosis is the first step. Written advice can be helpful in this instance. Modification of the local environment can improve symptoms, for example, increasing the humidity. Education regarding potential dietary modifications, an increase in omega-3 is clinically beneficial, and the correct ratio of omega-3 to omega-6 is also important. The identification and potential modification or elimination of offending systematic and topical medications, for instance, glaucoma drops containing benzalkonium chloride. The objective of ocular lubricants is to target one or more layers of the tear film. Consider this when recommending ocular lubricants. And if meibomian gland dysfunction is present, then consider lipid-containing supplements. Sustain Balance and Sustain Complete contain a patented mineral oil which is clinically proven to support the lipid layer. Lid hygiene and warm compresses of various types. It is important to stress that only commercially available warm compresses should be used, as a hot, wet flannel will not be adequate. It is also pertinent to mention that baby shampoo is not an option. There are many commercially available lid hygiene products on the market. If, and I stress the word if, the suggestions in stage 1 are proving inadequate, then the eye care practitioner should consider moving on to stage 2 of the plan. This includes non-preserved ocular lubricants to minimise preservative-induced toxicity. There are preservatives which are known to be toxic to the epithelial cells, and when we consider that benzalkonium chloride is a detergent, then it may be of no surprise. Tea tree oil treatment for Demodex if present. It is thought that a patient over 70 years will have a 100% likelihood of having Demodex infestation of the eyelids. Punctal occlusion to conserve tears. Moisture chamber spectacles or goggles. Overnight treatments such as ointment or moisture chamber devices. In practice, physical heating and expression of the meibomian glands. In practice, intense pulsed light therapy for meibomian gland dysfunction. As part of stage 2, some practitioners, who are qualified to do so, may introduce prescription medications to manage dry eye disease. These include antibiotics, steroids, and secretagogues. Stage 3 and 4 will only apply to a small percentage of dry eye disease patients and will normally be administered under the supervision of ophthalmologists. Stage 3 includes serum eye drops, therapeutic contact lenses, including soft bandage lenses and rigid scleral lenses. And finally, stage 4, amniotic membrane grafts, surgical punctal occlusion, other surgical approaches, for example tarsorrhaphy and salivary gland transplantation. In conclusion, the vast majority of dry eye disease sufferers can be managed by optometrists and contact lens opticians successfully if the staged managed approach is followed. Only when the patient is not responding to treatment should we move up through the various levels of treatment. If you have any further questions or would like more information, please contact your Alcon Business Development Manager or a member of our Customer Services team. This was brought to you by the Alcon Experience Academy and forms part of our Dry Eye online seminars. In the next seminar, we will look at how to integrate dry eye disease identification and management into your practice routine. Separate dry eye clinics or part of your normal clinic.